Today is American Diabetes Alert Day, when the American Diabetes Association issues a one-day wake-up call to the 60 million Americans who are unaware that they either have diabetes or maybe could be at risk for developing type 2 diabetes. The association is urging people to take the diabetes risk test, and if you score high, to make an appointment with your doctor. If you would like to take that test, visit our website, thedenverchannel.com, and click on As Seen on 7 News. It's hard to believe that about 35 to 40% of the adult American population has a condition called metabolic syndrome. That's a health condition that is characterized by obesity, high cholesterol, elevated blood pressure, and pre-diabetes.
Joining us now to talk a little bit more about this condition is Dr. Jeff Gerber. He is a family practice physician with Littleton Adventist Hospital. Thanks for being with us.
Thanks for having me. Good morning.
So explain this to us. Metabolic syndrome, it has to do with insulin resistance. It sounds a lot like diabetes in a way. What is that insulin resistance?
So insulin resistance is a medical condition that really helps us to understand the epidemic of diabetes and obesity in our country. It also helps us to understand better nutrition, specifically that carbohydrates is the fuel for this condition. And why? Because carbohydrates are simple forms of fuel. It's easy to burn and it's easy to store. And what happens is over our lifetime, we overeat. And this causes us to produce excess insulin. And as time goes on, the body becomes resistant to the message of insulin, and we develop the insulin resistance, which leads to further weight gain. Now, insulin, as you understand, regulates energy storage, and we develop a vicious cycle of insulin resistance where we gain weight, we produce more insulin. And it's a spectrum of illness, beginning with overweight, becoming obese, then pre-diabetic, and ultimately type 2 diabetes.
Doctor, the numbers on this are simply incredible. 35 to 40% of the entire adult American population. Does this mean that everybody, all of us, will end up getting some form of diabetes throughout our lives?
Well, certainly not. There are genetic factors that either put us more at risk or less at risk for developing the diabetic part of it. The point is that the condition is really an inflammatory condition, and it predisposes us to many medical problems that we see in modern society, not only diabetes, but heart attack, stroke, premature aging, arthritis, cancer, gastrointestinal illnesses, you name it.
So I'd imagine that there are ways like diabetes that you can treat it and prevent this even from happening, having to do a lot with diet and exercise.
Yes, and what's exciting is that we're looking to lifestyle change in terms of treating it. And since we understand that carbohydrate is the fuel for this condition, it would make sense to focus on carbohydrate content of food. And we teach patients about glycemic index of foods and how to make healthy food choices based on glycemic index. And so some of the bad foods are the sugar, bread, pasta, potato. Some of the good foods, the nutrient-dense foods, the high-protein foods, fish, chicken. And this will ultimately help people actually control appetite and eat less food. And there's also medication when we're struggling with the lifestyle modification.
And doctor, when we talk about getting out there and getting some exercise, very quickly that burns up some of the calories and some of the carbohydrates?
Oh, most definitely. Exercise is an added benefit.
All right, so even if you're not predisposed to this, this could be a great way for so many people to just kind of change your lifestyle and change your energy level.
Yes, very much. And what's surprising in our office is we see patients and we do what's called a 2-hour glucose tolerance test. And it's surprising that we see patients that are pre-diabetic and diabetic, and often the doctors and the patients don't even realize. And so they come in, it's early screening. We have to teach the population about this condition and how to make better food choices.
Okay.
All right, Dr. Jeff Gerber, thank you so much. We'll get out there and take that diabetes risk test today.
Thank you.
Thank you, sir.
And get out and exercise today.
Good idea.
Not a bad day to do it.
Good day
Before the
for it.
rain comes,
Yeah,
right?
really.
We'll get another check of the forecast in just a minute.